Di nuovo ancora buonasera.
Good afternoon again, ladies and gentlemen. I will make a very brief introduction. We'll give the floor to Professor KOTLIKOFF. You can read his very long resume in the booklet. He was and is a professor at many universities in the U.S. He is at present at Boston University. He worked for many financial institutions such as the World Bank and also at the Bank of Italy. Well, I think that the key element to be considered that can well illustrate the title of this lecture is that Professor KOTLIKOFF is really at the center in terms of themes of this festival. He is, I think, the top expert, or rather, he is the inventor of the idea of the generational accounting. That was a book of 1993. Even if his studies are at the center of his work as an economist, his first studies date back to the end of the 80s. That means he has been, thinking and processing the different ideas and theories for more than 25 years. The key subject for him, in very simple words, is how much we download to future generations in what we spend to generate a deficit today. In European systems, like in Italy, in the cost of welfare state, which in our country is partially responsible for the high deficits and the increase of debt, is, the healthcare system. This is an additional inequality. If you followed the multiple discussions of the Festival of Trento, you'll be well aware of the inequalities which can be found in the field of healthcare. That means accumulating inequalities for the future and to the detriment of future generations. This is something which usually at the center of the Italian political and public debate. Professor KOTLIKOFF will tell us how to measure inequalities. Indeed, his work as a scholar produced an economic model, which he will illustrate. That model highlights the major gaps existing in the economic and macroeconomic theory, and also in the language that we use to manage fiscal gaps, budget gaps, which are there. A very final comment, because I endeavor to be brief, is something to which we are all sensitive. In 2012, Professor KOTLIKOFF had decided to start fighting, at that time, the leadership of Trump, and he was a candidate as an independent, which is something possible in the U.S., something which is something different from the traditional Democratic Party and the no longer traditional Republican Party. So they can have independent candidates. It's a very complex mechanism, but if I understood correctly, he had to give up that very important project of major political commitment. because he could not find the presidential ticket. Sorry for simplifying things, but this is what I gathered. Maybe you can enlighten me later during the discussion. You have the floor. Thank you.
Thank you very much, Antonella. It's a great pleasure to be here in Trento, and it's lovely to be in Italy. It's a beautiful country. My wife and I have been spending some time near Florence for the last week, and you have a very special country, and it's got a very big place in my heart. I want to talk to you today about inequality. I'll just mention briefly that I was a candidate for president in the last election, but I was a write-in candidate. And unfortunately, unlike France, where someone like Macron can come out of the blue and get a lot of press attention, I came out and got very little press attention, so I'm not president. The president we now have is not someone that I think should be president. I don't think that he represents our country very well. I don't think he represents his party very well. I don't think he represents the people of the world very well, which America needs to do because we're the most powerful militarily and economically speaking country in the world. So, and I know that you're all very probably concerned about what just happened with our pulling out of the Paris Climate Accord. I think everyone should understand that this is a decision by a small minority of, well, it's a decision of Trump. And he doesn't have all the power in the world in our country or anywhere else. And there's a very strong commitment as a result of his decision by the private sector, by the companies, by the cities, by the states to abide by the Paris Accord. So I think in many ways, it may be that what he did was actually a good thing for the Paris Accord, indirectly. But it's clear that the climate is changing, and consequently, I'm going to take off my coat. So as Antonella indicated, I've been working over the years with, on my own and with other economists, primarily Alan Auerbach at Berkeley, on something called intergenerational accounting, which is to try and understand how different generations are going to be treated through time based on the fiscal policies being run in particular countries. So that's one aspect of inequality, and this talk is about a little bit about that, but it's mostly about inequality within generations. Intragenerational inequality. So there's intergenerational, across generations inequality, but there's also within generation inequality. And Alan and I have been studying that recently. And the idea of this talk is to try and indicate how these types of inequality should be measured. Because most of the measurement that we're seeing being done by economists, unfortunately, I don't think is connected to our economic theory. I don't think it's theoretically appropriate analysis, and that we need to basically stick with our theory to figure out how much inequality there is and will be in terms of future generations being affected, but whether it's climate change or healthcare, whatever, or nuclear proliferation. There's many threats to future generations, but regardless, we need to consider inequality appropriately. We need to study it correctly. So inequality comes down to differences in expected lifetime utility. So how many people here are economists? Not everybody. Okay. So we economists have a notion that people are happy, that their happiness derives from two major things. One is how much they get to relax, how much leisure they get to have, and also how much they get to consume. And so we measure their happiness in terms of, gee, how much do they get to consume and how much leisure do they get to have this year and next year and the year after, every year in the future, and how happy will they be as a result of their consumption and leisure. And what we assume, which seems absolutely obvious when you think about it, is that people have diminishing happiness from consuming more and more at a point in time. So, for example, if I had 1,000 steaks here, 1,000 pieces of meat, if I tried to eat them all at once, I would get very quickly satiated. I would get very tired of eating even Florentine beef. So what I'm naturally going to do is try and spread my consumption and also my leisure over time. And that's called consumption smoothing. So, and then one of the concerns that comes into play with expected utility has to do with risk. If I know for sure that I'm going to get to consume 20 steaks every year, or let's say 2,000 steaks every year, that's one thing. But if I am living in a situation where I get to consume 0 steaks in some years and 1,000 steaks in other years, then, or in other kind of events, situations, then I'm facing a situation where in some states of the world I'm very happy and I really have more steaks than I really want to eat. In other states of the world I'm very unhappy. So that's risk. That's economic risk. And when we're talking about inequality, we need to talk about not just the level on average of consumption that people get to do, and not just the level on average of leisure that people get to enjoy, but also the risks that people will perhaps have to work much longer than they expected or get to consume much less than they had hoped for. When it comes to health care, there's also how happy can you be if you're ill and you're not being, you may have an illness which is not in any way cannot be fixed by modern medicine, but you may also have an illness that can be addressed with modern medicine. And this framework, expected utility, can incorporate all these issues, including the key issue of this conference, which is healthcare inequality. So now, leisure is hard to measure. I don't know whether I'm actually enjoying leisure right now or whether I'm working right now. It's a great pleasure. I think it's more leisure than work at this moment. So it's very hard to measure leisure. So economists have been focusing more on consumption, and what they've done is to try and focus on the resources, the inequality in the resources that are used to pay for consumption. So we have people focused on income inequality, and then we have other people focused on labor earnings inequality, because income includes labor income plus income from assets. And then we have some economists focused on wealth inequality. But ultimately, we really want to focus on consumption inequality, and we also want to think about the risks that people are being exposed to. And these risks, again, go beyond just consumption and leisure. If the climate change that everyone except Donald Trump believes is happening will lead to the sea level rising by 6 feet by the end of this century and maybe 100 feet by the end of the next century, that will put a large fraction of the world's population at risk. And this is what today's top scientists really believe, that unless we change course, we will have that kind of a situation. It's not we, actually, it's our children and grandchildren, great-grandchildren. They will face these kinds of threats. So it's not just about consumption and leisure, but I want to focus today more on consumption because, again, we can't measure leisure very well. But I want to talk to you about consumption because I think we need to start to measure inequality with consumption and consumption correctly, and then start developing other methodologies to measure inequality from risk. And governments can generate inequality. They can also reduce inequality. Sorry, they can generate risk and they can also reduce risks. I think President Trump's recent decision is an example of a government that's trying to produce more risk for future generations. That's something real that can be measured. The loss of happiness or expected happiness as a result of that policy, that can be measured. So we can really use our economic tools to get at these issues. But again, today I'm going to focus more on something that we can more easily measure, which is consumption. And just to summarize again, there are these two types of inequality. There's intergenerational, and then there's intragenerational. So intergenerational is saying, well, look, if you take somebody like myself, who's I'm 66, over my lifetime, how much did I get to consume out of my resources? I earned a certain amount of money. Maybe I inherited some money. These are my lifetime resources. The difference between those resources and my consumption really represents what the government took away from me or gave back to me on net. So we want to look at different generations showing up over time and ask if they earn, what we project them to earn, if they have the lifetime earnings that we measure, let's say as of age 18, we measure all their earnings into the future. We project those earnings and we value it as of the year that they turn age 18. Okay, so we say, okay, this is their lifetime income, and then how much will they have to pay in lifetime taxes net of any transfers they receive? And we take the ratio of that second lifetime net tax payment to the first number, which is lifetime income, and that's their lifetime tax rate, net tax rate. And that's really generational accounting. And in the U.S., we are on a path to produce lifetime net tax rates for future Americans, which are roughly twice as high as those that my generation, I'm in the baby boom generation, they're roughly twice as high as my generation has and will experience. Now, why is that? Well, we have some official debt. Italy has a bigger debt to GDP ratio than the U.S., something like maybe 120% of GDP. In the U.S., it's about 70% of GDP. But we have a lot of other obligations that are kept off the books, like our paying for our pension plans, our Social Security system, our health care benefits to older people, to poor people, our defense spending. These all represent obligations out into the future. And they can and have been projected, so we can figure out, okay, the government has to pay for these things, these obligations through time. They have a certain value in the present. So we can value, when I say a value in the present, what I'm saying is a dollar that's going to be received or paid to, let's say to me in 20 years, it has a certain value today. I can put it aside and perhaps 80 cents today, invest it, and end up with $1 in 20 years. So the present value of that $1 in 20 years is 80 cents today. So all these payments that are going to be made to me and other people that are in the future can be valued in the present. And we can ask also, how much taxes will I and other people be paying? And we can then see whether the expenditures that the government projects, and I'm not just talking about servicing the official debt, paying interest and principal on the official debt, but making all these other expenditures like paying for the president's lunch, taking the president to Mar-a-Lago every 2 days to play golf. All those are expenditures into the future that have a value, and then there are also taxes that are projected. And in the U.S., we have this difference between these projected expenditures and taxes, which is called the fiscal gap. So if you project out through the end of time the present value of all the projected spending and subtract the present value of all the projected taxes, you end up with what's called the fiscal gap. In the U.S., our fiscal gap is $206 trillion today. That's an enormous number. Our GDP is about $20 trillion. So we're talking about a fiscal gap that's about 10 times annual GDP. Our official debt is about $20 trillion as well. So most of our obligations are off the books, have been kept off the books by politicians who have hired economists to help them hide the truth. So the accounting that is being done in Washington about our fiscal situation is far worse than anything that Enron Corporation did. Remember, they kept all their obligations, many of their obligations, off the books until it was discovered, and then they had to put some of the heads of Enron into jail. Well, many members of Congress should be in jail today, but it's not just from one party, it's both parties, and it's going back for the last 6 decades, going back to Eisenhower. The policy has been to take from young people, call the money that you take from them taxes, give it to old people. You guys are the young people. I take money from you, I give it to you old people, and I tell you young people, don't worry, when you're old, I'm going to take from the next set of young people and give to you. And that obligation to pay you benefits when you're old, when you're sitting over here, is kept off the books because of my choice of language. If I said that I was borrowing the money from you, then it would be on the books. If I say that I'm taxing you the money and going to make you a transfer payment rather than make you principal plus interest payments on the borrowing, just that choice of language keeps these obligations off the books. So one of the main things I've been pushing in my writings is a problem of deficit delusion, that we should not be focused on the official debt or deficits to try and measure how we're treating future generations, because those numbers are a result of how I call things, what language I use. So we don't want a measure of generational inequality to depend on whether I use one set of words or another set of words, whether I discuss the problem in French or Italian or German or Russian. It's the same problem. And economics says that the only way to measure things appropriately when it comes to generational burdens is to do this fiscal gap accounting and then figure out what it means for young generations. And what it means in our country is that if we don't get current generations to pay more or take less from the government, future generations will have to pay out of their lifetime labor income twice the tax rates than the current generations pay. Their net taxes measured as the present value and divided by their present value of their labor income will be twice as high as what my generation will end up paying. So our country is bankrupt, and we have a course of policy that we're running that is jeopardizing the well-being of future generations. And this is before we even discuss the failure, the healthcare issues that we face, the problems with North Korea and nuclear proliferation that we face, those risks, And before we discuss climate, okay, I'm talking about generational inequality based just on what our kids will be able to consume. Now, Italy, it turns out, is in much better long-term fiscal shape than the U.S. because you have much better control of your healthcare spending. Your defense spending is not as high as a share of GDP, as President Trump has been reminding you. And in addition, you have had major pension reforms, I think 2 or 3 major pension reforms. We have not had any pension reform in the U.S. We have, just in our pension system, an unfunded liability of $32 trillion. So if you just forget everything else and just look at our Social Security system, the present value of all this projected Social Security benefits minus the present value of all the Social Security taxes that are projected, that equals $32 trillion. That's far bigger than the official debt, which is $20 trillion. That's more than a year's GDP, which is, again, $20 trillion. So you can see we have major problems of generational inequity in our country, but I mostly want to talk today about intragenerational inequality. So what I'm saying in both cases is that we're measuring both things the wrong way. By and large, in every country around the world, in the IMF, at the World Bank, at the OECD, the focus is on official deficits and debts. And that's missing the true fiscal gap that countries are facing and describing it in terms of the implications for future generations. So we're basically doing intergenerational inequality analysis the wrong way. Now, there has been some progress. The European Commission puts out something called the S2 indicator, which has been calculating fiscal gaps for EU members. And again, on this basis, Italy turns out to look very good. But the U.S. does not. But basically, that's not the key measure of inequality when it comes to generations. The key measure is still the official debt and deficit, and that's what's discussed by the politicians, and that's highly misleading because by choosing the right words, you can produce any time path of deficits or debts you like. You can have the deficit rise to, the debt rise to infinity or decline to negative infinity. You can have it fluctuate through time. Anything you want, you can create just with language. This is very similar to what's going on in physics when it comes to measuring distance and time. The theory of relativity tells us that how we, our frame of reference, our language, what direction we are moving through space and at what speed determines how we measure things. So there's no unique time, no unique measure of time, and no unique measure of the length of this table. There are an infinite number of measures, none of which actually tell you anything because there are too many measures. So the debt and the deficit is one of those kinds of problems. It's a measure in search of a concept. It's a meaningless measure. So whenever you hear someone use the word deficit and debt, whether it's your professor or whether it's some economist or whether it's a politician, tell them, I have no idea what you mean, because you cannot have any idea. They cannot have any idea what they mean either, because they're just talking about their choice of words. They're not really talking about the underlying economy. But now, today I want to talk really about intragenerational inequality. And here what we do is we look at people at a given age. So, for example, I'm going to tell you about 40-year-olds in the U.S. primarily today, and I want to compare people that are poor and rich and middle class among 40-year-olds. And I want to look at their remaining lifetime resources, their wealth, plus their human wealth, how much they're going to earn measured in present value. And I want to line them up from the richest to the poorest. So the ones with the highest resources, the top 1%, to the ones with the lowest resources. And I'm just going to look at 40-year-olds. And the reason I need to look at kind of one age group at a time is that it doesn't make a lot of sense to compare somebody who's, let's say, 40 with somebody who's 80. Because someone who is 80 has already paid their taxes and received benefits in the past. And somebody who is 40 is going to pay a lot more taxes in the future and receive benefits in the future. So it's like comparing apples and oranges. So to do intragenerational inequality analysis, you have to look within a generation. Within, that's what the intra means, within a generation. And you have to focus on the key thing, which is lifetime spending. How much, if you take somebody, the top 1% of 40-year-olds, based on the resources they have, their labor income measured in present, their remaining lifetime labor income, and their net wealth. Well, if you just look at that, they may, the picture of inequality may be very different than if you look at their spending, at the present value of what they get to spend over the rest of their life, because the government may be involved in taking resources from the wealthy, from the rich, and giving it to the poor. So imagine that you're the 40-year-olds, and some of you are really rich, and some of you are very poor, and I'm the government, and I take all your resources, every single penny, every cent of your resources, and then I hand it out to you evenly, back to you as transfer payments. I tax it all away and give it all back to you. You will all end up spending the same amount, right? So we can't analyze inequality without looking at what the government is actually doing. And if you look at some of the work that's been done recently, for example, Thomas Piketty wrote a book that you're probably familiar with about wealth inequality. Well, there's no discussion in that book of inequality in fiscal treatment. It could be that we can't really study inequality in wealth without thinking about whether the government actually redistributes the wealth from the rich to the poor. So that's what economics tells us to do. To look at the bottom line, to look at spending inequality, because that's the bottom line of what you get to consume. And I've done this in a study with Alan Auerbach and another software engineer from my company named Daryl Kohler. And this study, which I'll show you results of in a second, is very different from conventional inequality analysis, because conventional inequality analysis, for example, the Piketty book, is comparing 80-year-olds' wealth with that of 20-year-olds. Well, we know from the life cycle theory of saving that people, when they're 20, they don't have a lot of money, right? Unless they inherited some money. But apart from that, they're going to be saving as they age for their retirement. So it doesn't make a whole lot of sense to look at inequality in wealth and compare 80-year-olds with 20-year-olds. 20-year-olds have not yet had a chance to accumulate wealth, and 80-year-olds have. So it just doesn't make any economic sense. But that's what he did, and other people are studying inequality in labor income or total income. And again, they're comparing old people with young people. This, to me, and I think to economic theory, is just wrong-headed. It's just not appropriate, because we're ultimately trying to get at people's remaining expected lifetime utility, and that depends on their consumption and leisure and risk for the rest of their life. And so somebody who's got maybe 20 years at most to live and somebody who has 80 years left to live, you really can't compare these two sets of people. So it's important to compare within each generation. So let's just do that. I'm going to show you some intragenerational accounting in 1 second, but I want to tell you how we actually, how the methodology works. So we have data from the Federal Reserve Survey Consumer Finances. It's a cross-section national survey. And what it does is it goes to different households and asks them a lot of questions. And it oversamples very rich people so that it doesn't miss the super rich. And it has population weights. So I could come to you. Your name is? Andrea. I could come to you. I'm the surveyor, and I can ask you about your labor income and about your wealth and about your retirement accounts and about your household composition, your wife and her earnings and how much you're paying in mortgages, mortgage payments. I collect all this information from you, and then what we do in this study is we take that data and we run it through a financial planning program, which calculates how much you will spend every year in the future, assuming you want to keep spending the same amount through time, adjusted for your family composition. For example, you may have some young children, so you're going to want to spend more when the kids are at home, so everybody has the same living standard. But then when the kids leave, you can spend less because you have fewer mouths to feed. So this program is something I developed through a software company that I started in 1993. So we take the 6,000 or so observations from the survey of consumer finances, and we take each cohort, so we'll take, let's say, 40-year-olds, take all the 40-year-olds, run them through the program, and then we figure out for each household, you're a 40-year-old household, how much you're going to be spending every year. And the assumption of the program is that you're trying to have a smooth living standard, that you don't want to have consume 1,000 steaks today and very few steaks when you're 50 and you're 80, but you want to have a smooth ride, a smooth living standard. And this is a proposition called the life cycle theory of saving. Who knows who got the Nobel Prize for the life cycle theory of saving? Modigliani, one of your most famous economists ever, along with a number of other famous Italian economists. And Franco was a good friend of mine. Unfortunately, he passed away, but great economist. But even going back 100 years, we have to think about Irving Fisher, who developed the theory of saving and intertemporal consumption smoothing. This really goes back to Fisher. So now, we now have software that can actually make this operational. You can take the data, run it in there, and a half a second later, I can see your whole spending path. And I can make different, the program incorporates borrowing constraints, cash constraints. So if you have very low income right now, but are going to have higher income later, maybe you have a big mortgage right now to pay. So your discretionary spending has to be lower as a result, right? And the program takes that into account. So it does, you economists here will recall the term, or know the technique called dynamic programming. It's a mathematical technique that's used to solve these kinds of problems. It was developed in the 50s by a fellow named Richard Bellman. And we have our program can do a dynamic program for your household in a half a second, maybe a quarter of a second actually. So it works very quickly, and even though it's a pretty complicated dynamic program, we've figured out how to get it to work really fast. And then you can check to make sure everything lines up, all the budgets are satisfied, so and that the consumption is actually smoothed apart from these cash constraints. So then you can see that the program's working. So it's like getting into a Ferrari and stepping on maybe you don't know what kind of car it is, but if you step on the gas, you know it's a Ferrari, right? Or a Maserati. You know it's an Italian car that works. Well, it's the same thing here. You can, without knowing all the inside of this program, you can see the results are correct. Everything lines up. So this is what we did. We took the survey of consumer finances. We take the 40-year-olds and the 30-year-olds and the 20-year-olds. We process them each separately, and we figure out gee, in present value, how much do you get to spend? And how much do you get to spend? All the 40-year-olds. And what's the inequality in spending? And we're incorporating in this program all the taxes that the federal government levies and all the taxes that the state governments levy and also all the transfer benefits that are provided by the federal government, like Social Security benefits and health care benefits like Medicare and Medicaid, and also the benefits that the state governments are providing. They also provide some of the Medicaid. There's also food stamps and welfare payments. So we took about 3 years to put together this program so that it would incorporate all the fiscal policy of the country, the entire country. So it's the first comprehensive. You're going to see in about 5 seconds, you are going to see the first real picture of U.S. inequality that's ever been generated. Because to do it right, you have to do it within cohort, and you have to incorporate all the taxes, all the transfers, and you have to incorporate not just 1 year's income, but all your future earnings and your wealth. You have to incorporate everything over the rest of your life, because utility is about the rest of your life. It's not just about a point in time. So this is what economic theory says to do, and so we're now going to do it. So just to be clear, the lifetime budget constraint, just a little bit of the algebra here. C is lifetime consumption, R is lifetime resources, T is lifetime net taxes. And so lifetime resources is human wealth, which is the present value of your labor income, human wealth, and W is your net wealth, like your stocks, your bonds, your retirement accounts, your assets. And also the equity you have in your home, that's part of net worth. So what we're trying to do is look at inequality in C, not just inequality in W or inequality in R, but inequality ultimately in C, because the T is important. So this is what Thomas Piketty's book was about, the fact that the top 1% of 40-year-olds have 19% of the wealth. So their share of the wealth is 19 times larger than their share of the population. They're the richest 1%. But their share of the spending is only 11.5%. So that's because the fiscal system is very progressive in our country. I'm not trying to suggest that there's no inequality in our country. All you have to do is look at Donald Trump's yacht to know, and how people are living in the poorest sections of any U.S. city, to know there's massive inequality, and it's massive inequality in spending. But we need to measure things correctly, and then we have to think about whether we want to go beyond the progressivity of the current fiscal system to make it more progressive, to make things less unequal. So you can see here that the top 1% are consuming a whole lot less than their share of wealth. The lowest 20%, their share of the wealth is only 2.5%, but their share of the spending is 6.3%. And this has to do with the redistribution from the government. So you see that redistribution in this picture right here, which is the lifetime net tax rates of different 40-year-olds. So the top 1%, if you take their remaining resources, put that in the denominator of a ratio, tax rate, and then take the present value of their taxes net of their transfers, then you can form a lifetime remaining net tax rate. So let's say that in present value, I'm a rich person, I'm a 40-year-old, I have $1 million in resources, either labor income has a present value and my net wealth together is $1 million. And out of that, the program says that I will be handing over in present value $200,000 in taxes net of transfers I receive. So my lifetime net tax rate will be 20%. So what this is saying is that the top 1%, their lifetime net tax rate is 34%, their average tax rate. And for the poorest 20%, it's minus 52.7%. It's negative because they're receiving more than they're paying. So you can see that the U.S. fiscal system is very progressive. Whether that's progressive or enough is, I don't think it's progressive enough because I see huge inequality in living standards in our country. But that's really my value judgment. My job as an economist is not to inject my values, is to really just discover economic realities and let society at large decide what to do about them, and also to suggest reforms that might help things. But if you look at tax rates based on current income, so if you just take this year's taxes net of any transfer payments this year and divide by this year's income, labor income plus asset income, you get average tax rates which look very different. So this is what these orange bars are very different, especially at the bottom. You can see that the fiscal system looks much less progressive on an annual basis than it does on a lifetime basis. And there's no economic rationale for doing things on an annual basis, except that that's what's there's no rationale for it in terms of our economic theory, but that's what we're doing down in Washington. The think tanks and Congress, they're all measuring inequality and fiscal progressivity based on these orange bars, and they should be using the blue bars to see what's going on. Again, it doesn't make sense to compare an 80-year-old with a 20-year-old and assume that people are going to live for just 1 year. That's what's going on down in Washington. And also probably in your country and other countries when it comes to this kind of analysis. So why are things so more progressive than you might have thought? Well, the top 1% are paying a disproportionate share of taxes, and the poorest 20%, they're not paying 20% of the taxes, they're paying much less. They're getting more than 20% of the transfer payments, of the benefits. The top 1% are getting a small share of the benefits. So that's where the progressivity is coming from, the tax transfer system, when you incorporate all the factors. There's also labor income, which is this orange bar, and that's more equally distributed than net wealth, than financial wealth and home equity. So this is what we need to look at. Now, here's a different way to look at progressivity, which is like marginal tax rates. The other was average tax rates. Here the question is, if I give you, let's say I come to, your name is? Susanna. Okay, Susanna, if I give you another $1,000, you're a survey participant in this Federal Reserve survey, and I give you $1,000. I run your data through the program, but then I increase this year's labor income by $1,000, and I ask how much will you get to spend in present value over the rest of your life based on that extra $1,000. If it turns out that you can get to spend $700 in present value, then you're facing a 30% tax at the margin, a marginal tax rate of 30%. So this is so our machinery can be used to figure out people's incentives to work. And we have in our country, as you have in your country, many different fiscal programs. We have about 20 major fiscal programs. And each of these programs has their own little tax system. Well, obviously, there's a federal income tax, but then there's things called, for example, food stamps. If you're poor, you get food stamps. You get the government sends you a piece of paper that says you can buy food with this stamp. It's like dollar, But if you earn more money, you lose those food stamps. You lose about 24 cents on the dollar. If I earn an extra dollar, I can lose 24 cents in food stamps. If I earn an extra dollar, I can lose 22 cents in the earned income tax credit, which is part of the federal income tax. I could lose my welfare benefits. Possibly I could lose all of my Medicaid benefits. So so the program incorporates all these programs so it can figure out comprehensively what the marginal effective tax rate is. And you can see that they're very high for all the different groups here. And these are median figures. So there's people above and below. Half the people are above and half the people are below. So if I look at the top 1%, they're at a very high median marginal tax rate. It's at 51%. Why is that so high? Well, if you earn money and you save a good part of it, which the rich would likely do, then they're going to have to pay taxes on their asset income in the future. So I earn an extra $1,000. Some of it I consume now. Obviously, some I pay some taxes on right now, my current income taxes. But then next year I'll have more assets because some of this money I'll save, and that will produce more asset income, and that will produce more taxes on that asset income, right? So these taxes, this is called double taxation, and they add up. So it turns out that half of the people in this top 1% are facing marginal tax rates above 1%. That's pretty high marginal taxes. But if you look at the lowest quintile, the poorest 20%, their median tax rate is 37%. That's also quite high. Some of these people have marginal tax rates well above 100%, well above 10,000%. Because if they earn another dollar or an extra $1,000, they will lose eligibility for certain programs. So our fiscal system is not well designed. It's not just that our country is going broke and endangering our future generations. We also have these very major disincentives for half the population not to work. And, I'm not particularly worried about the top 1%. I think they like to work just because they like to work. It's probably not going to affect their labor supply. If Elon Musk has to pay 80% at the margin, he's still going to go work. He loves his job. He gets to build cool-looking cars, test drive them himself, build spacecraft, all these things that he gets to do. The poorest people are the ones we need to think about. If we've got half the people above a 37% marginal tax rate, what that is doing is locking a lot of people into poverty. So the Republicans in our country are concerned about the government. The reason that Trump was elected, I think, has a lot to do, there are a lot of factors. Part of it was Hillary was not such a great candidate. She didn't seem to have many new ideas. The Russians were helping Trump. Lots of reasons, right? But there's also this issue of do we have a system that's actually kind of focused on the future, on our children? Are we doing what we need to do to make sure that our kids are not going to be facing massive obligations, tax obligations? These were themes of the Republicans, but there's also marginal taxes. That's another concern of the Republicans. And in the debate right now about tax reform, you hear some members of Congress talking about, on the Republican side, talking about the high marginal taxes that people are facing, and they certainly are facing them. So this is, before you can fix a problem, you need to understand it. And so this is about understanding the problem. I just want to show you that the story about wealth inequality, these are 20-year-olds, wealth versus spending inequality being very different is true for 20-year-olds at the top end and at the bottom end. And here's 60-year-olds, again, they have a much smaller share of spending than they do of wealth. So we have to, I think we're now at a point in terms of our technology in economics where we can actually do things the way economics says to do it when it comes to measuring things. But, just a couple more slides, and then we'll see if there's some, well, maybe a minute or two for questions. If you look at people ranked by their lifetime resources, and you rank them by their current income, you get big differences. For example, the third quintile, those people that have of 40-year-olds that have they're in the third 20% group. That's what a quintile is. They've got kind of like the third highest level of income, current income. You might think that they would also have, they'd be in the third quintile when it comes to their lifetime resources, but only 57% are in that quintile. So using current income as a proxy for remaining lifetime resources is not appropriate because it's misclassifying people very significantly. So a last point is about risk. We need to try and incorporate the risks we're imposing and also taking away from people. When we provide health insurance or we get rid of health insurance, for example, that's affecting people's risks of having very high, having their diseases cured or not. And this kind of analysis is good for certain purposes, but it's not going to handle that problem. It's not going to study how expected lifetime utility for a cohort is distributed, taking into account the risk that people face, the probability that in 10 years they're going to be very sick with the disease, which could be cured, but they're not going to get the cure because the government has set up the healthcare system this way rather than that way. So I think the way we're going to have to study that is with computer simulation. And I've been, during my career, been developing computer simulation models that can that are much more stylized, abstract, than actually going and looking at the data and really just processing the data. But these data are not the whole picture. They're part of the picture. They're an important part of the picture. But we need to do, in effect, Monte Carlo simulations, simulate all the outcomes that different generations will face and also different groups within a generation will face over the rest of their life, and try and understand the dispersion, the inequality in expected lifetime utility from the risk as well as kind of the average level of spending that they get to do. So let me stop there, and thank you so much for coming.
Grazie, Professor KOTLIKOFF.
Thank you very much, Professor KOTLIKOFF. Professor KOTLIKOFF, I'm very sorry people are leaving just because your presentation is over, but I think that we should take advantage of this opportunity to raise questions. So after this lecture, we are given the opportunity to raise questions. By the way, I'd like to thank both the professor and Susanna Camufo as well. So you developed a model that measures inequalities, something that would otherwise be impossible. Do we have questions from the floor? I had a couple of questions to raise, but I see that somebody is ready to ask a question. Can you please state your name?
What you are showing us.
La farebbe in italiano perché
Quali
c'è la
sono-
traduzione, scusi, gli altri se no.
Quali sono le politiche che
What policies do you suggest to offset the issues that you raised?
I did it in a very different way, which is I sat down and spent about 4 months writing a 157-page book about what to do to fix these kinds of problems. And, for example, on the health care, we have the president, we had about 50 million people without any health insurance in our country before President Obama took office. We're now down to about 30 million people without health insurance. If President Trump has his way, we'll go back to 50 million people without health insurance. My view is that we need to give everybody in our country an identical health insurance plan, a basic plan paid for by the government, but it's one in which it would be a system where the government would pay the insurance company that you choose based on your expected cost under the basic coverages. So if you had diabetes, you would get, and you chose this particular insurance company, call it, let's say, Kaiser Permanente, they're a big insurance company in the U.S., and you have diabetes, the government would send Kaiser a very big check to cover you for the year. And then the government is out of the picture. Now they have to take care of you for the year. A year later, if you're healthier, whatever your condition is, you would choose either Kaiser again or some other company. And again, the government would send a check to whichever company. So there would be competition among the companies, and the government would be able to figure out or determine what is covered. It might be that these particular drugs are covered, but those other drugs are too expensive for the whole country to afford, and they're not going to be included in the basic coverage, in the basic plan. Now, the other important thing is this paying the insurance companies a different amount based on each person's pre-existing condition, their expected cost. That gets rid of the entire problem with competition in the healthcare sector, because the health insurance companies will no longer have an incentive to leave the people with diabetes out of the picture and just try and get people that are healthy, instead of doing that cherry picking, that's choosing the good cherries and not choosing the bad cherries. Instead of that, they'll realize that the diabetic patient is coming with a much bigger payment. So we need to understand, the basic market failure in the health insurance industry and just address it directly. And now, if we had everybody having an identical basic plan, and I'm talking about spending 10, 11% of GDP, which is pretty much what Italy spends on GDP, on healthcare. We currently spend about 18% in our country, but I think if we spend 10, 11% of our GDP on a basic plan for everybody, we would have a much less unequal society. I'm also proposing a very different tax system than we now have. I would get rid of the federal income tax, the corporate income tax, the estate and gift tax, and all that sounds very Republican, but I would replace those with a value-added tax, a progressive consumption tax that kicks in after $100,000 of consumption, an inheritance tax that would kick in after you receive $5 million of inheritance at a 20% rate. I'd give everybody a $2,000 per person payment, a demogrant. I'd also have a carbon tax, so about $80 per metric ton of CO2 emissions. So that was part of my platform, was fixing the healthcare system, fixing the tax system also fixing the Social Security system with a brand new Social Security system at the margin, freeze the old system, pay off what you owe under the old system, and set up a new system that's modern for young people, younger workers, that is not unfunded, is fully funded. So there are ways that economics can help, but I don't see the public, we're not having that debate because we have politicians who are kind of trapped in their language. Even if they wanted to, were supportive of what I'm proposing, they'd be too afraid because it would alienate some members of their party if they were to say, use words that they're not used to hearing, that the party members are not used to hearing. We're very much trapped in our language. And that's where somebody from the outside can make a difference. It's not, unfortunately, it's not, I'm sorry I wasn't elected president. I'm sure you're sorry I wasn't as well. But that's the situation. So we're going to have to make the best of President Trump. And I think there are members of Congress, especially in the Senate, Republican senators who are grown-ups, who are adults, who are going to make sure that if we end up with a new health care system, it's not an abomination, that we don't have 24 million people uninsured, more people uninsured than today. And I think they're going to probably do a tax reform that makes some economic sense. So the picture, I think, is probably better than many people fear. Any other questions? Very good.
Sì.
Mi chiamo Piero.
My name is Piero. Professor KOTLIKOFF, I have a question not on policies, but on what's happening for real. You've been very clear in explaining that measurements of inequality are inaccurate because they do not consider the difference in different age cohorts. So my question is, how can we consider life expectancy so if you correct for life expectancy, I wanted to understand whether wealth distribution in the U.S. is fair or less fair, is more or less unequal. What is your feeling thinking about the inequalities in European countries if compared to the U.S.? And what do you think is the impact of the aging? What do you think that aging, what role does aging play in that, on inequalities in the U.S. and in other European countries?
That was an excellent question about the importance of life expectancy. The poor, the lowest 20% certainly die at younger ages on average than the rich. And that's become increasingly the case. We have new evidence from the National Science Foundation study that one of my co-authors was actually working on, Alan Auerbach, in developing these data, which show that the poor are dying younger and the rich are dying later. So this is perhaps for the first time in U.S. history that we have poor people dying at younger age. Their life expectancy is actually declining. So in our study, I neglected to tell you, but in our study we took paid very careful attention to differences in life expectancy, because what we did is we could figure out the lifetime labor income of these different people in the sample, and then using the data that was generated by the National Science Foundation, we were able to look at all the survivor paths of each household. So, for example, if I take Antonella's as a sample observation. She's, let's say, 40 years old. She has a husband. Well, it could be that she passes away in 3 years and her husband lives for 20 years. For 20 years, or he dies in 5 years and she lives to 90. These are all different survivor paths. So what we did in our calculation is we weighted each of these survivor paths by the probability of their occurring, and we took into account the fact that her probabilities of dying and her husband's were based on how rich they were. So I think we've done a very careful job on that. The study took about 3 years to complete, and a large part of it was dedicated to making sure we dealt with that problem. And also, when people die in our study, we treat the money that they leave as part of their spending. So it's not like we are leaving out some of the spending that the rich do. We're counting that as part of the spending of the rich, the bequests that they leave, and also any estate and gift taxes they have to pay at the end. That's also incorporated as part of their net taxes. So we tried to be really thoughtful about that issue of life expectancy. Any other? It's been a long, you guys are probably pretty hot and had enough economics for the day. That's just fine. You have a question back here? I see somebody with a hand partly. Do you have a question? Yeah, there's a question back there. No, the other side?
A destra.
A destra.
Sulla destra.
A destra. Sì.
Hello. I guess I just had a question about...
In Italian, please, because the other...
No Italian.
No
English.
Italian. Fantastic. Go.
Sorry.
I tried, but I don't know if...
I just actually wanted, if you could just go over again your results. So what you're saying was that actually, because what we've been hearing for the last few years is that wealth inequality and other forms of health inequality, life expectancies in the US are huge. And you're saying that that's lower than we think it actually is, and that in terms of tax, the US is very fiscally progressive. Is that what?
Yeah.
Ci hanno detto che negli Stati Uniti le disuguaglianze sono molto forti, lei invece ha un pochino ci ha abbassato i dati qui oggi, è così, questa era sostanzialmente la domanda.
Gracias. I think the answer is that we need to look at the actual facts. And the facts are that spending inequality is much less than wealth inequality, but it's still very big. You know, if the 1% get to spend, top 1% get to spend 11 times their share of resources, of their share of the population, and the bottom 20% only get to spend 6.5%. They should be spending at least 20% to be equal. They're only getting their share of spending is only 6.5%. There's still a lot of inequality. It's just that it's much less than some people have made out. We need to look at spending inequality. And then the other thing I think you're raising is, have things gotten worse over time in the U.S.? Have we become more unequal? This is one of the propositions of Piketty, that things are becoming, and also Emmanuel Saez from Berkeley, that inequality is increasing. Well, I think it could be true, but it may not be true. It's we need to look at the inequality in spending over time. So we need to go back perhaps to like the 1960s and do the whole study for 1960. There is data from 1960. The Survey of Consumer Finances goes back to 1962 to 64. So potentially we could actually do a cross-time comparison of look at 40-year-olds today at their inequality in spending and look at them back in 1962 and see whether things have gotten much less equal. Back in 1962, we had a top marginal tax rate of, I think, 90% or 70% in our federal income tax. So it's possible that things, we had a more progressive fiscal, it could be that spending inequality is bigger now than it was. But I can't say for sure without doing the analysis. So it's kind of like let the facts talk, but develop facts that actually connect to the theory. Don't just focus on numbers that are kind of make a good headline, but don't actually tell you that much about what's really going on. Or don't tell you everything that's really going on. Let me put it that way. Yeah.
I have some question.
Yes. Another question.
In realtà ne volevo
Actually, I had two questions. I have more of a theoretical question, perhaps. Question one. Lawrence Summers and yourself had a controversy with Franco Modigliani. Lawrence Summers is the theoretician of stagnation. So I was wondering whether you believe that there's stagnation of the world because there's too much saving. This is my first question. Is there stagnation because of too much saving?
Is there stagnation because of too much saving?
Yeah.
I don't think so. I mean, if you look in the U.S., we have a very low saving rate. If you measure saving properly, our national saving rate is about 4% right now. It was about 15% in the 1950s. So it's gone downhill decade after decade. There's been some movements, but it's basically gone downhill. Our domestic investment rate has pretty much followed our saving rate. So our domestic investment rate, net domestic investment as a share of net national income, is 5%. It used to be 15% as well. So countries that save tend to be countries that grow. They also are countries that invest. If you look at China right now, they're saving at a tremendously high rate. They're investing at a very high rate. They're growing at a very high rate. If you look at Japan in the 1950s and 60s and 70s, same thing. They were very high savers, very high investors, very high growers. So I think the correlation, I think our problem in the U.S. is that we're consuming too much. We're not saving and investing enough. And what we're doing, you know, if I'm the U.S. government and I take from young people money and I give it to old people as transfer payments, and I tell young people, don't worry, you'll get to expropriate your children when you're older. What do you do with the extra money? Well, you spend it. We don't have a lot of altruism in our country. It's not like older people are taking the money and giving it back to their kids and trying to protect their kids from this fiscal problem that they're facing. Instead, the data show very clearly that the old people are consuming as if they had no children, as if they're not related to anybody else. And so we've been able to test what's called intergenerational altruism, and it's very clear that there's very little evidence of it in the U.S. I would say there's no evidence of it. So our saving rate is very much connected with our transferring from the young to the old. This again goes to the issue of generational equality or equity. We've been engaged in a take-as-you-go policy. Take from the young, give to the old, take from the next. It's really a Ponzi scheme. There's another famous Italian economist, right? We've been running a Ponzi scheme in our country for 6 decades and keeping it off the books. That's the definition of a Ponzi scheme, which is to engage in a financial machination where you don't disclose what you're doing. That's what Madoff did. That's what Ponzi did. That's what Enron did. These were all Ponzi schemes in their own way. I don't think that saving is our problem. I think that low saving is our problem. We're not saving too much. We're saving too little, and we're investing too little. But I think the other big issue we have to worry about is robots, because robots are taking over people's jobs left, right, and center. And a lot of people would say, well, you know, if you look at agriculture, we had about half of the workforce in agriculture back 100 years ago. Now it's only 2%, and people still have jobs. But my response to that is, look at the horses. We had about 20 million horses about a century ago. We may have 500,000 horses now. We did actually put the horse out of business. And the concern I have with robots is that they will put so many people out jobs or out of good jobs, that people will not be able to afford what the robots make. So there's a kind of a general equilibrium problem here, as we call it in economics, where all these guys, these tech CEOs at Amazon or at Google who want to have drones drop our packages and have trucks that have no drivers deliver things. Well, 7% of our workforce in the U.S. is involved in transportation. So if all this happens, as they plan it to happen, and they're working very hard to make it happen, well, what are those 7% of people going to do? It's not like so I'm very concerned about automation and what that means for the next generation and how that's going to work out, because you can write down theoretical models where everybody in the future ends up worse off. You have technological improvements, but because of this problem of people losing their jobs or losing their wages, they're not able to buy the goods that are able to be produced in some ways more cheaply with better technology, and then through time you end up in the long run with everybody worse off. So there's a paper on my website which is called KOTLIKOFF.net, that's the website, and it's called Robots Are Us. It's really about the fact that we are producing kind of intelligence in the form of software programs that are really taking over our jobs. So these robots that we've created are really former versions of us. We're competing with dead humans, in effect, dead engineers, engineers who produced things in the past. So we have to be very concerned about inequality in the context of automation, because you can show theoretically that this can be bad for everybody in the long run. Everybody can be worse off. The way to respond to that in terms of policy is to make sure that the winners pay the losers along the path. So that means that a Mark Zuckerberg or a Elon Musk or the heads of Google, they have to pay enough of their newfound wealth to other people so that these other people can afford to buy the products that they're selling. That's really important. So that's one of my big concerns about the future. Should we?
Ecco, se non ci sono altre domande,
So as there are no further questions, I think that we can draw a close to this meeting, and you will be dealing of the intergenerational gap for robots. In a few years, you'll have to deal with the intergenerational gap for the robot. I'd like to thank Professor KOTLIKOFF and welcome to Italy. Thank you very much for your lecture.